Mr. Emeka came to your clinic. He is a 65-year-old male. He reported the following: severe pain in the mouth. Pain may or may not be associated with facial swelling. Pain is worse during chewing. Pain disturbs sleep. Headache may or may not be present. An introduction. Good morning, my examiner. I am candidate number 36. I am here for my practical examination. Then turn to the patient and introduce yourself. Then tell the patient I will be attending to you today. I understand you are having mouth pain. I will ask you a few questions and examine you so we can determine the cause and provide appropriate care. Please cooperate with me. Step 2. Biodata and history taking collect. Name, age, sex, occupation, address, contact information. What is the problem? Where is the problem? Is there pain in the teeth or gum? When was it noticed? Are you able to eat your regular diet? Does the pain increase when you eat hot or cold drink or even any food? Does the pain make you not sleep very well during the night? Have you ever noticed bleeding like blood coming out from this, your gum or any part of your mouth? How do you brush your teeth? Do you know how you are supposed to brush your teeth as an elderly person? How many times a day do you brush your teeth? Have you ever noticed any wound ever in the mouth whenever you are brushing? Past medical dental history. Previous similar episodes. Step 3. Physical examination proper. First, carry out a general assessment of the patient's overall appearance. What are you looking for? You are assessing the patient's personal hygiene, noting any irritability, smell of alcohol or tobacco, or visible signs of injury. These may indicate possible social or psychological problems, such as loneliness, neglect, or substance abuse. Next, perform a thorough oral examination. Gather all required equipment for the assessment of the oral cavity, including tongue depressor, gloves, swabs, pen light, and any other necessary instruments. Ask the patient to open their mouth, using a pen light and tongue depressor while wearing gloves. Inspect the gums for sores, swellings, bleeding, white patches, discoloration, loose teeth, plaque deposits, or cracks. Examine the teeth carefully for dental caries. Systematically inspect the oral cavity starting from the incisors, canines, premolars, and molars. Then proceed to the roof of the mouth, hard palate and soft palate. Look for sores, wounds, injuries, or color changes. Check the tongue for plaque, coating, ulcers, or lesions, and assess the tongue's edges, surface, underside, and the base. Also inspect the uvula and pharyngeal area. Palpate the gums to assess for tenderness, bleeding, or abnormal masses. Examine the buccal mucosa and assess the mouth size laterally for any asymmetry or swelling. Inspect the lips for cracks, lesions, or color changes. Finally, take the patient's temperature, as systemic infections often present with oral manifestations. Step 4. Interpretation and clinical judgment. From the findings, consider likely causes. After completing your examination, you are expected to document your findings. If these findings align with the following, General appearance. The patient appears ill-looking, in pain, or malnourished, with possible facial swelling. Oral cavity. Poor oral hygiene, foul-smelling breath, sore gums, swelling around the gums, and discharge of blood or pus. Teeth. Presence of holes. Dental caries. Discoloration, loose or missing teeth, and plaque deposits adhering to the tooth surfaces. Then, even if not all features are present, your clinical judgment should strongly suggest a severe condition, with dental abscess as the most likely diagnosis. Dental abscess, severe dental caries, gingivitis, periodontitis, oral cellulitis. Classify the severity mild, moderate, severe according to the standing orders. Management according to standard orders. The standing orders direct that you should take the following actions. Give the patient paracetamol tablets, 1 gram orally 3 times daily for 3 days. Alternatively, give ibuprofen 400 milligrams orally if the patient does not have a history of peptic ulcer disease. Ibuprofen should be taken after meals. Second supplementation, vitamin B complex, 1 tablet orally daily for 2 weeks. Vitamin C, 200 milligrams orally daily for 2 weeks. Third, oral care instruction. Teach the patient how to rinse the mouth with warm saline water. Fourth, referral. Refer the patient to a higher level facility. While dental abscess is the most likely diagnosis, other conditions such as cellulitis should also be considered. Explain to the patient the reason for referral, emphasizing the limitations of primary health care facilities in managing such cases. Ensure the patient understands the importance of going to the referral center for better care. Fifth, patient counseling and health education. Explain the nature of aging and its associated challenges, highlighting that it is a natural process and a privilege to reach old age, though it comes with certain health issues. Demonstrate proper toothbrushing techniques using a toothbrush model, emphasizing the importance of brushing twice daily, especially before bed, to remove plaque. Encourage consumption of calcium-rich foods and fruits high in water content such as watermelon, cucumber, and seafood to aid in oral hygiene. Advise avoidance of sugary substances. If taken, they should be in small quantities and followed by mouth rinsing to reduce bacterial buildup and prevent dental caries. Encourage personal hygiene practices such as bathing twice daily, combing hair, shaving pubic hair when necessary, and using good soap and clean water. If a missing tooth is found during examination, encourage the patient to consider dental filling or dentures to prevent infection in that space. Advise regular dental checkups at least twice a year. 6. Closing the consultation. Ask if the patient has any questions. Reinforce the need to visit the referral center and ensure follow-up. With this, your examination and management according to the standing orders is complete.